Hey there, folks. Welcome to today's episode of the Strategy and Leadership Podcast. My guest today, Dr. Julie Wilson. I looked at her CV. I asked, I said, you went for this thing. And when we were chatting in our pre, she's like, I want to do ethical business. I want to attract good people. I want to make sure that they understand, what they're getting into. And I think that transparency, that clarity has led to numerous awards of how to do great business. I'm so excited to chat. Julie, thanks for joining us on the podcast today.
Oh, thank you so much for having me here, Anthony. It's a real pleasure. I really
Yeah,
appreciate
so sorry to jump in. T uh, tell anything I missed as part of your bio. What do you love about the work that you get to do? And then I'll get into some questions.
Oh yeah. I mean, I really feel a deep passion for what I do. I think one time I interviewed someone, she says, it looks like you have sunshine on your heart every time you talk to me. And it really is my passion to run my business, which makes it easy when I put in the hours because it doesn't feel like hours. I am a family doctor and I've been working as a family doctor for over 10 years. But one thing that I found was that I wanted to change some system level issues, but I wasn't involved in the health authority or some greater organization. I was just myself with my little mom and pop clinic. So I thought maybe I could just do this on my own. Took me about 5 years to get there that I wanted to get from one clinic and decide to expand. But once I decided to, we've had tremendous growth, as you mentioned before. We now will have 20 clinics by this fall and 200 doctors and nurse practitioners.
Amazing. Uh, what is it like? So we're in BC.
Yeah.
What is it like, driving forward system level change and like really like driving that forward? So I find that fascinating. What's that like as part of your leadership? And then another question that I have is, as a family doctor, you need to speak to people about important things, frankly. And I think those are two interesting pieces of like leadership, kind of moving with and against trends and also being able to communicate effectively, like for change and for effect. It sounds like those are two things that you've done like really, really well.
Oh, I really like how you put that together. I mean, it's true. As a family doctor, I talk to many people every day, people from absolutely every walk of life. And they tell me all of their internal issues, their family issues, their worries, their medical conditions. I see people with all sorts of education and language skills, and I need to communicate to them. So I like what you said because I actually do feel that those skills did translate into me improving the business and growing it systems wise. Because when I talk to each person in my organization, I talk to them as a person. I want to feel their humanity and give them what they need to be happy in the workforce. And it sounds funny that this is a business strategy, but I think that, in the olden days, people might say, oh, I worked at this one job for 30 years. Now you see people jumping from job to job to job. But that doesn't happen in our company. It doesn't happen because I think people feel seen and heard, and they're willing from that to see and hear other people. It creates an amazing culture. That's why we won best place to work in healthcare 2024 and 2025 in Canada.
Amazing. By the way, in addition, I should mention family doctor, so doctor of medicine. And where did you learn just like care and nurture? Like it really comes clear that for all of those things, that's one of the things that's important. Did they teach it in the school of medicine? Did you learn it through your like clinical work? Was that learned as somebody who's like, okay, now I've got more people similar but different to me to kind of build this thing?
I think the medical school application process tries to select for people who like caring. It's one of those fields. But definitely, as you see more and more people and their struggles, you gain a lot of perspective in life and you see many things that are truly heartbreaking. And at first, it does really hurt to hear all these terrible stories, see people that you care about be sick or die. But over time, you get more used to it. Some people can get jaded, but I think what happens to a lot of us is we actually feel a deep compassion that we want to help people. When we see it happening to people, we want to help them even more because we know what's coming. And I think for me, when I see that there are 700,000 people in this province without a family doctor in a primary care based system, I feel actual pain. I feel sad. And it's my life's passion to try and fix that because I want people to have that connection. I want people to have that care. I don't want them to be alone or sick or lost without help.
I mean, here, here. That's phenomenal. Everybody's got their perspective on society that we're not going to touch for today's podcast. But I will this is like capitalism for the win. And I think that it's important because to be a great employer, to have people there, it has to be a win-win-win.
Yeah.
I'm sure intellectually people know how to like fix things that are wrong with them sometimes, but don't actually do it. As it relates to motivating employees and supporting them, what was maybe a surprise or a challenge that you didn't expect as you like grow this like workforce of amazing people in the province?
Well, when I first started, doctors are a bit like cats, they lovely people, but they don't necessarily work well together. So I wanted to build my clinic, and I was always trying to just, tailor everything to everyone. I'll give you this, I'll give you this, I'll help you with this. And it became a jumble, became a mess. And then it started to become conflicts, which was very stressful for me because I like a happy workforce. So what a big surprise for me is I started telling people when I onboard them, this is a no drama environment. Things will go wrong, something will break, somebody will say the wrong thing. But we work together with benefit of the doubt to fix everything by giving each other respect and avoiding all drama. And then after that, almost all the drama ended. That was really surprising. I think people like rules. They like to just be told what to do. And I didn't know that this is something people could be told to do, just to behave nicely. And that was a huge surprise, but very, very important for the growth of my business.
Excellent. I think the transparency, clarity, and just yeah, people like rules. People want to be successful in a system. There is order to a system, but people want to be successful in it. And if you tell them how to be successful, and they're like, okay, cool. Like I'd rather win than not win. Um, I mean, there's so many things that we talked about here. I guess what is next for the business? What are you looking forward to as part of this journey, professionally, personally? What excites you about where you're at as of, 2025 and looking forward?
I feel really excited because I've onboarded this amazing team, and we've taken some of our, front desk managers, many of whom were students when we first hired them, and just built their careers through the company. And you see them growing, trying, coming up with ideas. And I find that to be so beautiful. I feel like a mother to the clinic, seeing all these people growing. And one thing that excites me is they are excited about the growth. So they are saying, when we have 30 clinics and 40 and 50, and I can see that they're excited about their career prospects, excited about helping the patients and helping the team. And every time we have a team meeting or we have a Discord chat group, it's just a delight to read everybody's excitement, motivation, and happiness. So what I'm excited about is our team together building 30, 40, 50 clinics, giving people careers that they never imagined that they would have. And then, of course, providing healthcare to more and more people. We already have 200,000 patients in our roster. I'm hoping we'll get to 400, 500,000 in the next few years.
Holy heck. Well, I see why all of those awards were well deserved. I congratulate you for everything that you've done. I look forward to everything that you will do. Thanks for being here on the podcast. It was just so cool to hear about your journey that impacts so many people across the province, both people who need healthcare, but also who want a great place to work, and also a model type organization for what the future of work can really be here and abroad. So, Dr. Julie Wilson, thanks for joining me today.
Thank you so much, Anthony. Take care.